Well, today's senior segment, Dr. Angelica Motta joins us to discuss peripheral vascular disease. Thank you so much for joining us.
Thank you for having me here.
Absolutely. Now, first and foremost, let's talk about this. What exactly is that?
Peripheral vascular disease, it's a disorder or disease that actually treats or diagnoses problems in the vessels that in the circulatory system, which it ranges from top to bottom, outside of the brain and the heart, which it's composed of arteries and veins, which that's what drives blood to the tissues and then carries them back into the heart to oxygenate them again.
Okay, now what are the symptoms? Are there any type of symptoms to look out for?
It depends on where the area of we're trying to look for, but most of the times when we say peripheral vascular disease, a lot of people associate it with the lower extremities, peripheral arterial disease. And when we talk about that, it's mainly pain on the legs, numbness on the legs. If you see that your legs or your toes are turning a certain color, like black, blue, if you have a lot of pain when you walk, those are warning signs that you need to seek medical attention.
And how do you diagnose it?
Usually the first thing is we do a physical examination and we assess the nerves, the arteries, and either by indications, change of color. And then once we assess that, then we order ultrasound to kind of visualize the arteries and the flow across the veins and the arteries. And depending on which is the area that needs to be treated, that's how we're going to treat it. Depends if it's arterial. A lot of the times we have to go and do something more invasive, like an arteriogram. If it's the veins, then again, it just depends on which one it needs to be treated.
Now, who does treat this?
Cardiologists. The cardiologists actually we actually evaluate it. They're the cardiovascular specialists, as our name says. It composes of the cardiology part and also the vascular system. So now if we were to diagnose something that's unable to be treated with what is our area, either stenting or depending on what we need to do, then we would need to refer to a cardiothoracic surgeon or a vascular surgeon to do something more aggressive.
And so with peripheral vascular disease, normally when you think about, arteries being clogged, you think about the heart pumping and things like that. Now, this isn't really associated with heart attacks, or is it?
It actually, they've seen that people that have heart attacks, they're also a higher risk for peripheral vascular disease, because a lot of the times, if you have atherosclerosis in your heart, in the arteries of your heart, you're probably going to have atherosclerosis in the arteries of your neck, of your legs, of your abdomen, and that's why, in a lot of this, it's people that either have predisposition to these diseases or they're smokers, which those are a very high risk for peripheral arterial disease, and that's how.
But it's mainly something that you see in your legs. Is that what you're saying?
Well, we can see it on, well, as far as symptoms, yes. For the pain, yes. And venous disease also, it's another area. And you see varicose veins, we also map those. And it just, like I said, a lot of the time pain in the legs, we assess it and then we diagnose it and then we treat it accordingly.
Okay, and last question. What is the treatment? Is there a way to fix this problem?
Yes. If it's arterial, a lot of the times we can do either, depending on how much the extent of the blockage is, you can either stent it. If it's very severe, then you need bypass surgery. If it's very mild, then we treat it medically. And we do a kind of like a rehab treatment, which is exercise and walking. If it's venous treatment, varicose veins, venous insufficiency, we can do ablations, which we can just shut down the vein so we can actually reroute the flow to another area, and it improves the flow to the leg.
All right, doctor, well, thank you so much for joining us. We learned something new today.
Thank you so much.
Peripheral vascular disease and how you can treat it. Thank you so much.